previously done by thoracic paravertebral. Why? Because less invasive, safer, and simple. Very simple block. As you see, the patient sitting position, the probe in longitudinal long axis, and the needling cephalocaudal direction, and the direction of the needle towards the transverse process itself, one of the transverse process, just to inject between the transverse process and the erector spinal. There will be spread of local anesthetic, and this spread reaching the thoracic paravertebral space. So involve both ventral and dorsal rami. It gives so quite enough block for most of the painful condition related to thoracic region, but does not give such a dense block to be used for total anesthesia or mastectomy. Here the transverse process, and this is the target of injection between erector spinal muscle and between the transverse process. And there is another approach to inject, as in this side, superficial to erector spine rather than deep to erector spine. But nowadays, there's approval to use this approach deep to erector spine between it and the transverse process. If we look here, this is the erector spine muscle, rhomboid muscle, trapezius muscle, transverse process, just to advance the needle towards transverse process and inject like this spread of local anesthetic. Very simple and safe block. And here the extent of the area involved by this block, in cephalocaudal area from T2 to T9. In the anterior posterior direction, from the area تقريبا mid-clavicular area anteriorly and posteriorly 3 cm from midline, and involve the axilla and upper medial aspect of arm. This block also can be done in transverse approach, like in this case for the patient cannot stand or under GA. This is the needle and this is the transverse process. There is another block which is retrolaminar block, which is just like erector spinal block. The only difference is to target the lamina rather than the transverse process, as in this picture. This is the target of retrolaminar block, and this is the target for erector spinal block. Both of them give the same result, but the retrolaminar block involved with more epidural spread of local anesthetic. These are two blocks. This is retrolaminar, target the lamina, and this is the erector spinal, target the transverse process. And thank you very much. If there is any question, I'm happy to answer after completing the discussion.